Hello viewers, thank you for tuning in yet again to Afya Jimudu TV, your health education channel. My good name is Wamadhai Jogona, a reproductive health specialist. The treatment of sexually transmitted infections in girls and ladies. Before treatment, we ought to prevent ourselves from contracting the sexually transmitted infection. And one of the things we have to observe is that you ought to have or to be in a relationship whereby the sexually transmitted infection status of your partner is known to you. You also have to minimize or limit the number of your sexual partners. The other thing is the proper use of condoms. The other thing you also ought to observe is to abstain, especially for those who are not in a marriage relationship. Now, before we move on to the treatment of the sexually transmitted infections, that is the STIs, we ought to know why we should be treated properly and timely for the same. Reason being, they are able or they are in a capacity to bring about problems in your future. Actually, if not your whole entire life here on earth, they might make it miserable. These complications include a lower abdominal pain that will never be going away, a urinary tract infection or pain when passing urine which will be so frequent it will give you depression, a vaginal or discharge from your birth canal that will be difficult to go away, cancer of your genitals which will spread to the rest of your body, being in a capacity of not having children or having frequent miscarriages. Also, it is another reason why your newborn will die or lose their life before their first 4 weeks of life. It will also see that you lose your relationship, that is your marriage. They can also bring about a genital ulcer disease whereby we have the popular genital warts and the herpes, whereby you might not want anyone in future to see what is happening in your genitals. You will lead a lonely life, and that is one of the reasons some of the ladies are single, because they don't want anyone to see the genital warts in their private parts. Remember to always leave your children under the care of people whose sexually transmitted infection status is known to you as the employer, because this way we are going to prevent your children or your young ones from contracting the said infections. Remember, they are not always transmitted when we are having sexual intercourse. Some of these diseases, like the genital warts or the herpes, can be spread by way of touching the infected area, and then they are transmitted to the other person when the infected fingers come into contact with the genitals of the young ones, especially when they are being washed. Now we can move on to the treatment of the sexually transmitted infections, and in this case we have 3 categories. Category 1 is where we have pain when passing urine and an abnormal discharge coming from your birth canal, that is the vagina. Do not forget to have yourself screened for cervical cancer, including breast cancer, regularly. It is good to have your young boys and girls being vaccinated for human papilloma virus. It is good to make sure that your growing teenage children are aware of the diseases, that is the sexually transmitted infections. and it is also good to be screened for the said infections even when you do not have the signs nor symptoms and you are sexually active. Remember, it is always confidential here. So the treatment will include oral medication, and this is for those, that is in the category 1, for those who have pain when passing urine, including an abnormal vaginal discharge or discharge that is coming from your birth canal that was not initially there and you are sexually active. To get the prescription, you will have to send 290 Kenya shillings via M-Pesa pay bill number 4067925. Account is S.T.I. It is registered under Health Translated. For category 2, in the second category of treatment for sexually transmitted infections, we have the pelvic inflammatory disease, that is the PID, whereby there is pain of the lower abdomen and it might be accompanied by an abnormal vaginal discharge, and sometimes there might also be pain when passing urine, and this follows a sexual escapade, or maybe you are in a marriage relationship and you are sexually active. And the treatment here is for those who are not expectant. It is always good to rule out the possibility of an existing pregnancy. So a pregnancy test is better done or conducted to rule out the existence of the pregnancy, since some of these medications are contraindicated in pregnancy. So to get the prescription for the treatment of the pelvic inflammatory disease, that is the PID, you will send 320 Kenya shillings via M-Pesa pay bill number 4067925 to account number PID, which is registered under Health Translated. In the third category, we have the genital ulcer disease, whereby it is abbreviated as the GUD. This is whereby you have ulcers or wounds in your genitals that develop spontaneously and might follow a sexual encounter. That is, there was no trauma. In this case, I'm not including the genital warts, since the treatment of genital warts will vary depending on whether you are expectant, the number of the warts in your genitals, including the size, and also the status of your immunity. So in the treatment of genital ulcer disease, that is the GUD, I'm not including the genital warts. It's only genital wounds, ulcers or lesions, including a rash that could be very painful, that could be suggestive of herpes genitalia. So to get the treatment, you will send 320 Kenya shillings via M-Pesa pay bill number 4067925. Account is GUD for genital ulcer disease. So it is registered under Health Translated. Until in our next shows, thank you. See you in our next health educative shows. Please remember to subscribe, comment, and share.